Today I'm going to discuss about the temporal bone. First of all, the presenting parts. Okay, it contains it contains four part. This is the squamous part. Okay, this process is zygomatic process. This is the external acoustic meatus, and this is the tympanic part. This is the styloid process, and this is the mastoid part, and this is the mastoid process. On the inner aspect, it contains a process. It is called Petrous part. Okay, this is the Petrous part. Then the anatomical points. This is the temporal bone of the right side. The plate-like squamous part is directed upwards and laterally. The Petrous part is directed medially. External acoustic meatus is directed laterally, and the zygomatic process is attached to the external surface of the squamous part on its lower part, and it is directed forwards and lies slightly horizontally. So these are the anatomical points. Then ossification of the bone. The squamous part as well as the styloid process ossifies through intracartilaginous ossification, and the rest of the parts ossifies through intramembranous ossification. Another question, the derivatives. The styloid process. This styloid process is a derivative of the second pharyngeal arch. Okay. Now let's discuss about the squamous part. The squamous part contains external surface, internal surface, anterior inferior border, and a superior border. Okay. External surface is smooth and it forms the temporal fossa. It forms a part of the temporal fossa, providing attachment to the temporalis muscle. From the lower portion of the squamous part, it is attached to a zygomatic process. Okay. The zygomatic process is directed forwards and it articulates with the temporal process of the zygomatic bone. Okay. Now, below and backwards, behind and backwards, it is limited by a supramastoid crest. Okay, this is the supramastoid crest, and just below the supramastoid crest, it is bounded by a triangular area. This triangular area is called the suprameatal triangle. Importance is, in case of adults, 12 to 15 millimeters deep to the suprameatal triangle lies the mastoid antrum. Okay, let's come to the zygomatic process. It contains a root and the tip. Okay, the root is divided into anterior part and a posterior part. The posterior part of the root, see, this is the mandibular fossa. It forms the articular portion of the mandibular fossa, and the anterior root forms a tubercle. Okay, providing attachment to the lateral ligament of the temporomandibular joint, and this mandibular fossa articulates with the condyle of the mandibular rami, also known as the head of the mandible, forming temporomandibular joint, and it is a condylar variety of synovial joint. Okay, see, the root contains superior surface and inferior surface, and this is the zygomatic process. Contains superior border, inferior border, inner surface, and outer surface. Superior border medially provides the attachment to temporalis fascia, and laterally it provides the attachment to epicranial aponeurosis. And this supramastoid crest, it provides the attachment to the temporalis fascia. Okay, this is the inner surface of the squamous part, and it contains multiple impression. Okay, see, there are multiple impressions right here. These are the impressions of the sulcus gyri of the cerebral, and it is also called the cerebral surface. And there are various vascular impressions. These are the middle meningeal vessels. Okay, see, this is the anterior inferior border, and this is the superior border. The anterior inferior border articulates with the greater ring of the sphenoid bone, and the superior border articulates with the squamosal portion or squamosal border of the parietal bone. Okay, see, there is a point right here at the junction of the anterior inferior border and the superior border of the squamous part of the temporal bone. This point is correspondent to the terion, Its importance is due to this point lies the anterior division of the median vessels. Okay. Now let's come to the mastoid part. This is the mastoid part. Okay. So this is the temporalis muscle, and this is the fascia covering the temporalis. Okay. See, it is providing attachment to the zygomatic process of the temporal bone. Now the mastoid part. It contains external surface, internal surface, superior border, and a posterior border. Okay, and this is a process called the mastoid process. This mastoid process is absent in case of children, but it is prominent in case of adults because of the pull of sternocleidomastoid. And this portion provides the attachment of three muscles. Okay, these are the sternocleidomastoid, splenius capitis, and longissimus capitis. See, there is a notch right here. This notch is called the digastric notch, providing attachment to the posterior belly of the digastric muscle, which is supplied by the facial nerve because it is derived from the second pharyngeal arch. Okay, see, there is a group right here, and these groups lodges the occipital artery. It is a branch of the external carotid artery. Okay, and this is the superior border, articulates with the squamosal border, posterior portion of the squamosal border of the parietal bone, and this is the posterior border articulating with the temporal border of the occipital bone. Okay, now see, this is the internal surface. It is marked by groove. Okay, by a large groove. This is the sigmoid sulcus, and it contains the sigmoid sinus. Okay, now what is a sinus? It is a dilated vein that contains blood and cerebrospinal fluid. Okay, let's see, this is the superior border of the petrous part, and this is the posterior border of the petrous part. It is related to the superior petrosal sinus, and it is related to the inferior petrosal sinus. Okay, this is all about the mastoid process and the mastoid part. So this is the mastoid process, and it provides attachment to the sternocleidomastoid. This is the sternocleidomastoid muscle. Okay, and this is the posterior belly of the digastric muscle, which provides the attachment with the digastric notch. Okay, now let's come to the petrous part. So this is the petrous part. Okay, in anatomical position, it contains an apex and a base. The base is attached to the internal surface of the squamous part. So it contains apex, base, anterior border, superior border, and posterior border, and three surfaces: anterior surface, posterior surface, and inferior surface. This is the inferior surface. Sorry. Now see, towards the apex there is a foramen right here. You see it. Okay, this hiatus lodges it is the superior carotid hiatus, and it lodges the internal carotid artery. Okay, see, downwards is the inferior carotid hiatus. They together form the carotid sinus. Okay, which lodges the internal carotid artery. Now in the anterior surface there is a depression right here. Okay, there is a depression right here. It is the impression for trigeminal ganglia. Okay, now what is a ganglia? Collection of nerve cells outside the central nervous system. In case of brain, it is called a nuclei, right? A nucleus. And the apex articulates with the body of the sphenoid close to the dorsal sella through a ligament. It is called the petrosphenoid ligament, and it forms a syndesmosis variety of fibrous joint. Okay, it is the impression for the trigeminal ganglia. Okay, now there, see here, there is a depressed area. It forms the roof of the internal acoustic meatus. This is the internal acoustic meatus, and this is the external acoustic meatus. It is the part of the external ear. Okay, Now see, there is a elevated portion right here. This elevated portion is called the arcuate eminence, which forms due to the presence of the superior. Sorry. So this is the arcuate eminence, which forms due to the presence of the superior semicircular canal, and posterior to it lies a thin plate of bone. Okay, this is called the tegment tympani. Forms the common roof. Okay, it forms the common roof of. So this tegment tympani, it forms the common roof of number 1, middle ear, mastoid antrum, and the osseous portion of the acoustic canal. Okay, this is the anterior surface. No, this is the posterior surface. It contains the internal acoustic meatus. Okay, what are the structures that transmits through this internal acoustic meatus? 2 nerves and 1 artery. The labyrinthine artery, which is a branch of the basilar artery, the vestibulocochlear nerve, and the facial nerve. Okay, facial nerve has both motor and sensory fibers, and vestibulocochlear nerve has only sensory fibers. Okay, see, posterior to this portion, posterior to the internal acoustic meatus, lies the aqueduct of vestibule that contains succus and ductus endolymphaticus, which contains the succus and ductus endolymph. This is all about the posterior surface. Now the inferior surface. See, the inferior surface contains a rough area which provides the attachment of the levator belli palatini. Okay, then lateral to it, it forms it forms the sulcus tubi with the sphenoid that contains the cartilaginous portion of the acoustic duct. Okay, now see there, this is the inferior carotid hiatus. Then it contains a well-defined groove known as the jugular groove, and it is related to the superior bulb of the internal jugular vein. Okay, the superior bulb of the internal jugular vein lies here like this, and this rough portion articulates with the jugular process of the occipital bone. Okay, now see, this is the styloid process. It provides attachment to 3 muscles and 2 ligaments. The 3 muscles are stylohyoid, styloglossus, and stylopharyngeus muscle. Okay, and 2 ligaments are stylohyoid ligament and stylomandibular ligament. Now the nerve supply of these 3 muscles are: the stylohyoid is supplied by the facial nerve, derivative of the second pharyngeal arch. Styloglossus is supplied by the hypoglossal nerve. Okay, and because it is the derivative of the third pharyngeal arch, and the styloglossus, it is supplied by the glossopharyngeal nerve. Sorry, stylopharyngeus is supplied by the glossopharyngeal nerve. Okay, now this is the stylomastoid foramen right here. It transmits the stylomastoid branch of the posterior auricular artery as well as the facial nerve. Okay, it is all about. Okay, another thing, the styloid process, the 3 muscles attached to it and the 2 ligaments are all together, they are called the styloid apparatus. Okay, now this is the tympanic part. It forms the non-articular part of the mandibular fossa, as well as it forms the wall of the external acoustic meatus. See, there is a fissure right here. This is called the Squamous-tympanic fissure. 3 structures passes through it, are transmitted through this fissure. Okay, this 1 nerve, 1 artery, and a ligament. They are guatta-tympanic branch of the facial nerve, tympanic branch of the maxillary artery, and the anterior ligament of the malleus. Okay, so this is all about the tympanic. This is all about the temporal bone. This is the anterior surface. It contains a foramen right here. See, the greater petrosal nerve transmits through this foramen, and it is a branch of the facial nerve. There is a group right here. See, the lesser petrosal nerve passes through this groove, and it is a branch of the glossopharyngeal nerve. So this is all about the temporal bone.